Hi, Dr. Simon. I'm Jade Shaughnessy. I'm Associate Director of Clinical Services here at Bridge.
Nice to meet you.
Nice to meet you. Thank you so much for coming to our Behavioral Health Drop-In Center during BIPOC Month. We've recently undergone renovations thanks to the Smith Family Foundation, and we're so happy you can be here to see them.
Yeah, no problem. So I'm Dr. Simon, the Chief Behavioral Health Officer for the City of Boston and a Bridge board member.
Great to have you here. So this is where young adults come in the first time they're coming to Bridge. You'll notice that we have comfortable chairs for them to sit and wait. We have charging stations so they can charge any of their electronics. We have access to showers, laundry, kitchen, so they're able to change their clothes, wash their clothes, take a shower, and get something to eat or drink. So we really value having them meet their basic needs when they first come in.
I'm just going to sit in the chair.
Oh yeah, give it a try.
It's kind of like the airport. You get the...
Yes, exactly.
Awesome. So I'm a youth or adolescent. I come here, intake. Who navigates me? How do I get through this process?
So for our intake process, you're going to meet with the intake counselor, and they're going to learn all about what's going on for that young adult. How they heard about Bridge, why they're coming here, where they've been, go through mental health and medical health history and current status, if they're in school or if they're working. Basically learn a little bit about them and see how our menu of services can be helpful for them to address their strengths and needs and any barriers. And then we bring in Matin to help them go through all the different programs here at Bridge.
Hi, Matin.
Hey, Matin.
Nice to meet you.
Nice to meet you.
Yeah, Associate Director of Youth Services and Engagement. My job is interesting. I get the lucky opportunity of talking to every young adult about what program that we can actually align with them.
Yeah.
You know, so once they walk in, and then, you know, obviously they're going to be pretty nervous, and I feel like it's kind of important that they see somebody of color as well. That we navigate them through what process that we can fit them in.
And as you're referencing that,
Yeah.
in terms of who comes in, right, who self-navigates here, what do they look like, age demographic, racial demographic? Can you share anything about that?
So we see people between the ages of 14 to 24, and in the intake, or all of our clients at Bridge, about 87% of them identify as BIPOC, and then within the behavioral health therapy, 91% of those clients identify as BIPOC.
So we're here,
Yes.
Matin is going to navigate me,
Yes.
and so help me understand what is happening on this floor.
Absolutely.
So you'll come down the hallway, you have the teen's office to the left,
Yep.
the bathroom with the shower to the right, and then in here you'll have our kitchen. You'll see which, thanks to these renovations, is much more up to date than it was in the past. And so we're able to just give people snacks while they're waiting, or for to take with them.
Yeah.
We can make them breakfast sandwiches, lunch sandwiches, things like that.
And what time can I, as an adolescent, come to this space, come to Bridge?
Sure. So Bridge is available for young adults Monday through Friday between 9 to 5.
Okay.
My favorite part of Bridge is that a young adult can just walk in. So they don't need to be referred by anybody else, and they don't need to schedule an appointment. They can just come up to the drop-in, and they'll get their basic needs met and then be seen by one of the providers here.
Awesome. So what other services are happening on the floor?
Sure. So we have a partnership with Boston Healthcare for the Homeless. And so every Wednesday all day and Thursdays afternoon, you can find either a nurse practitioner or a doctor here.
Awesome.
And this is first come, first serve for our young adults. And they can also help them make sure that that they have mass health or that their insurance is up to date.
Got it. So Boston Healthcare for the Homeless, medical services, even potentially ensuring that they get insurance to get these services.
Yes, exactly.
Okay. And other services that are on the floor?
Sure. Well, you'll hear we have a load of laundry going in here. So we have a washer and dryer in this space. And then this is also where we keep any hygiene products that a young adult might need, either while they're here at Bridge or if they need to take some with them before they go.
Got it.
And then also twice a week we have psychiatric services on the floor. So this is one of the psychiatrists from MGH, Dr. Burke.
Awesome. Dr. Burke, Dr. Simon, nice to see you.
Dr. Simon, nice to see you.
Awesome. So twice a week
Yeah.
they're here.
Yes.
And we I know Dr. Burke, and he's an adolescent and adult psychiatrist. It's pretty rare to find psychiatrists, but twice a week folks from MGH come here, and again, adolescents have access to that.
Yes. So here at Bridge, it's really important for us to break down any barriers that young adults might have to access care. Before we had our psychiatry partnership, it was really difficult to get our young adults to even consider calling to make a psychiatry appointment. And then when they did, we were finding huge wait lists. So here it's much more accessible and it's more welcoming. So we can just, walk the young adult by. If they're feeling kind of hesitant about making the appointment, they can say hello, and eventually they'll get to know them and become a familiar face.
So a nice warm handoff.
Yes, exactly.
So we have medical services, Boston Healthcare for the Homeless, psychiatric services, partnership through MGH, other types of services that are available.
Yes, so you'll see the rest of the offices down here at the end of the hall house our behavioral health therapists.
Okay.
So I'll take you down to see one of the therapy offices. Our therapists are licensed clinicians. They use a variety of modalities, and we were recently trained in dialectical behavior therapy. So we had a 16-month online intensive training. So they use the skills that they learned with their clients. Any young adult interested in therapy can access it here at Bridge. And our therapists are usually, the team of therapists are usually seeing about 10 to 15 clients a day. All right, so you can head in and take a look at the space.
Sit in the client chair.
Yeah. So we try to make the spaces feel welcoming for our young adults.
This is a very beautiful view.
Yes, we're very lucky to have the location right across from the Boston Common. And here at Bridge, we're a multi-service agency, and we really want to break down the stigma of mental health, and that's why we try to make the psychiatric and behavioral health services so accessible to the young adults that come in here.
Awesome. So I'm coming in, go to intake, help get navigated by Matin. I can get medical care, psychiatric services, behavioral health services, DBT modality, and also housing.
Yep, so Matin would also help people navigate to the other floors of Bridge,
Okay.
where we have housing, education, career services, and case management.
Okay. And what did this space look like before?
That's a good question. So we just really did kind of like a facelift or an update. So we have new paint, new carpets, new, more updated, comfortable chairs.
Yeah.
The kitchen space is definitely more up to date. And then, of course, new washer and dryer, because we always want to make sure that that's working and accessible for our young adults. So again, we're very thankful to the Smith Family Foundation for the renovations.
Awesome. Well, I've enjoyed the tour, and the type of services you all are providing are top-notch in terms of what any person can come in and get immediate access to: shower, laundry, medical care, psychiatric care, behavioral health services. I'm not sure that there's another place in Boston that's specifically targeting unhoused, young adults in this kind of way.
Well, thank you so much. It was great having you here.
Yeah, thank you.